Hi everyone, my name is Betz. I'm a first year DAT student at Indiana State University. I'm going to be doing a video blog, three series video blog about evidence-based practice. I'll be interviewing. This episode will be myself, and the next two I will have two other guests on. So I'm just going to start off. First question, what is evidence-based practice? Evidence-based practice is a three-pronged approach to healthcare that integrates best research, clinician expertise, and patient values to come to an optimal patient outcome and making the best treatment decisions for your patient. Best research includes things such as the evidence that you're looking at. So level 1 evidence of systematic reviews is ideal, or a meta-analysis, but really looking at all the research and categorizing it by strength. Then clinician expertise, what have you experienced as a clinician? What have you found worked for you and your patients? What has not worked for you and your patients? And then patient values, like culture. Different cultures will allow different sorts of treatments. For example, in Chinese culture, they prefer more traditional medicine, or Eastern medicine, such as cupping or acupuncture. So those might be more under the patient preference, under patient values. And the clinician takes all these three parts and tries to put it together to make the best decision for their patient. Also, evidence-based practices, or finding research, is divided into 5 steps. The first is formulating a question using the PICO acronym. P is for patient, I is for intervention, C is for control, and O is for outcome. When you're formulating a question and you write out your question should include each of those components when written out. The next step is finding the research, actually going out to databases and different sources and locating the research. The next step is analyzing the research, determining its strength. Is the study performed well? Is it reliable? Is it valid? The fourth step is determining the sufficiency of evidence. Is there enough strong evidence supporting the research question to come to a good conclusion? And then evaluating the outcome. Are you going to actually perform this treatment? Are you not? And then evaluating how your patient responds to it. Next question for myself, how do you utilize evidence-based practice in your athletic training practice? Well, personally, I'm currently not practicing. I'll be practicing in a few months, but the way that I have used it in the past in my clinical rotations, I am just out of undergrad, so the way that I've used it in my clinical rotations so far is very similar to the process. I have a question, usually about a patient, and I'll go to a database and look up the information that's relevant to my patient. I then come to a conclusion based on the evidence that I find. Is there a better method for treating this? Is there another method? Is that method more useful? Whatever my question is, I evaluate the evidence and come to a conclusion, and then I go ahead and implement whatever my conclusion was. At least that's what I've done in the past. Do I feel prepared to practice evidence-based techniques? Certain parts of the evidence-based process, I feel comfortable formulating a question. I feel comfortable finding the research. The parts that I don't feel so comfortable with, though, are analyzing the research and determining how strong the evidence is, and then determining is enough evidence. I'm not entirely sure what constitutes enough evidence. And then I do feel pretty comfortable, evaluating the outcome. So watching my patient and determining if it was a better than my previous treatment. And then finally, how much experience do I have with evidence-based practice? Like I said earlier, I just finished my undergraduate degree a few months ago, so all of my experience with evidence-based practice is within the past primarily 2 years, for when we started really looking into research and involving research in my athletic training curriculum. So with that being said, that's the end of this little blog. I hope you enjoyed it, and I'll have another one coming up soon. Thank you very much.